So this is the topic about injury around the shoulder and fracture humerus. So what are the injury around the shoulder and what is the fracture of humerus? So let's begin from the anatomy, relevant anatomy. So shoulder girdle क्या है? Shoulder girdle, it comprises of the clavicle, आगे scapula and the humerus. So shoulder girdle comprises of the clavicle, scapula and the humerus. These three bones articulate with one another. These three bones articulate with one another to give the shoulder a unique feature of freedom of movement in all directions. This maximizes the reach of the hand in all directions. This maximizes the reach of the hand in all directions. The clavicle is the only long bone with membranous ossification. फिर से पढ़िए. The clavicle is the only long bone with membranous ossification. The muscle attached to its medial and lateral third. Medial and lateral third are responsible for displacement following a fracture. Medial end of the clavicle articulate with the sternum to form the sternoclavicular joint, the stability of which is provided by the thickened portion of the capsule. Medial end of clavicle articulate with the sternum to form a sternoclavicular joint, the stability of which is provided by thickened portion of the capsule, मोटा portion of capsule. The lateral end of the clavicle articulate with the acromion process to form the acromioclavicular joint. The stability of this joint depends partially upon the acromioclavicular ligament. The stability of this joint depends partially upon the acromioclavicular ligament. And the more important stabilizing structure, the coracoclavicular ligament. The stability of this joint depends partially upon the acromioclavicular ligament. And the more important stabilizing structure, the coracoclavicular ligament. The latter connect the conoid tubercle. The latter coracoclavicular ligament connect the conoid tubercle on the undersurface of the lateral end of clavicle to the coracoid process. The ligament has two parts, conoid and trapezoid. These ligaments must be torn before the acromioclavicular joint can widely displace following an injury. The scapula is a flat bone. What type of bone? Flat bone. Thickly covered by muscles. Such thick cover do not allow displacement of fracture of this bone. Also, because of its rich vascularity, scapular fracture usually unite. Look at the figure. Clavicle, acromioclavicular ligament, coracoid process, acromioclavicular joint, acromion process, head of humerus, and scapula. The scapula is a flat bone, thickly covered by muscle. Such thick cover do not allow displacement of fracture of this bone. Also, because of its rich vascularity, scapula fracture usually unite. The proximal end of the humerus consists of head articulating with glenoid cavity of the scapula. Proximal end of the humerus consists of the head articulating with glenoid cavity of the scapula. Glenohumeral joint or the shoulder joint proper. The head is separated from the greater and lesser tuberosity by anatomical neck. Proximal end of humerus consists of head articulating with glenoid cavity of the scapula, glenohumeral joint or the shoulder joint proper. The head is separated from the greater and lesser tuberosity by anatomical neck. The region below the tuberosity where the globular upper end of bone joint the tubular shaft of bone is called the surgical neck. Fractures are more common at the surgical than the anatomical neck. So shoulder glenohumeral joint को glenohumeral joint कहते हैं. So this is a ball and socket joint, inherently unstable because the ball is big and the socket is small and shallow. Consequently, only about one third of humeral head is in contact with the glenoid cavity at any one time. Consequently, only about one third of humeral head एक तिहाई of humeral head is in contact with the glenoid cavity at any one time. The capsule of the shoulder joint is lax and permit freedom of movement. The strong muscles surrounding the joint contribute a great deal to the stability of this joint. The important among these are the rotator cuff muscle, supraspinatus, infraspinatus, teres minor, and subscapularis. The important among these are the rotator cuff muscle, supraspinatus, infraspinatus, teres minor, and subscapularis. The interval between subscapularis tendon and supraspinatus tendon is called rotator interval. The interval between subscapularis tendon and supraspinatus tendon is called rotator interval. So this concludes the basics. Now let's begin with the fracture. So fracture of the clavicle. So what is fracture of the clavicle? So this is a common fracture at all age group. It usually results from a fall on the shoulder. Shoulder पे गिरना or sometimes on an outstretched hand. Outstretched hand से. So what is the pathoanatomy here? The junction of middle and outer third of the clavicle is the commonest site. Middle and outer third of the clavicle is the commonest site. The other common site being outer third of clavicle. This fracture is usually displaced. The outer fragment displaces medially and downward. Because of gravity and pull by pectoralis major muscle attached to it. The inner fragment displaces upward because of pull by sternocleidomastoid muscle attached to it. So sternocleidomastoid muscle, inner end, and pectoralis major muscle laterally. So displacement of clavicle. For diagnosis कैसे diagnose करेंगे? The diagnosis is simple in most cases. There is a history of trauma followed by pain, swelling, crepitus, pain, swelling and crepitus, crackling sound at the site of fracture. One must look for any evidence of neurovascular deficit in the distal limb. So diagnosis can be confirmed on an X-ray. So figure of 8 bandage ऐसे होते हैं, 8 bandage, figure of 8 bandage, 8 की तरह लग रहा है ना. So treatment: fracture of clavicle unite radially even if displaced. Fracture of clavicle unite radially even if displaced. Hence, reduction of the fragment is not essential. A triangular sling is sufficient in cases with minimal displacement. Minimal displacement है, triangular sling is enough. So fracture of clavicle unite radially even if displaced. Hence, reduction of fragment is not essential. A triangular sling is sufficient in cases with minimum displacement. Active shoulder exercises should be started as soon as the initial severe pain subsides, usually 10 to 14 days after the injury. So figure of 8 bandage may be applied to a young adult. Figure of 8 bandage applied to a young adult with a displaced fracture. It serves the purpose of immobilization and gives pain relief. Open reduction and internal fixation is required either when fracture is associated with neurovascular deficit or in some severely displaced fracture where it may be more of a cosmetic concern. In such cases, the fracture is fixed internally with a plate or a nail. Then complication we will have two: early complication and late complication. Early complication शुरू में हो जाएगा, क्या होगा? The fracture fragment may injure subclavian vessel or brachial plexus. And late complication, shoulder stiffness is a common complication. Especially in elderly patients. So late complication, shoulder stiffness is a common complication. Shoulder stiffness is a common complication, especially in elderly patients. So late complication, shoulder stiffness is a common complication, especially in elderly patients. It can be prevented by shoulder mobilization. रोका जाता है by shoulder mobilization as soon as the patient become pain free. Shoulder stiffness is a common complication, especially in elderly patients. It can be prevented by shoulder mobilization as soon as the patient become pain free. Shoulder stiffness is a common complication. Stiffness हो जाएगा, कड़ापन, especially in elderly, बुढ़े लोगों में. It can be prevented by shoulder mobilization. Shoulder को mobilize करके ठीक किया जा सकता है. As soon as patient become pain free. जब ये pain free हो गया, shoulder mobilize करिए. Malunion and non-union. Malunion मैंने abnormal तरीका से जुड़ जाना, non-union में जुड़बे नहीं करना. तो latter being very rare. Non-union जो होता है जुड़बे न करना, so it's a very rare. Often cause no functional disability. and need no treatment. कोई फंक्शनल डिसेबिलिटी नहीं करेगा और कोई ट्रीटमेंट भी नहीं चाहिए. Malunion and non-union often causes no functional disability and need no treatment. So rarely for a painful non-union of clavicle, painful pain होना और non-union of clavicle, open reduction and internal fixation with bone grafting may be necessary. तो ये थी हमारी क्लेविकल की कहानी. Now come to स्कैपुला. स्कैपुला के बारे में पढ़ते हैं हम लोग. तो फ्रैक्चर ऑफ स्कैपुला आर लेस कॉमन. फ्रैक्चर ऑफ स्कैपुला क्या है? लेस कॉमन है, कम होता है. एंड इन मोस्ट केसेस अनइम्पोर्टेंट, और इम्पोर्टेंट भी नहीं है, बिकॉज पेशेंट रिकवर वेल विदाउट मच ट्रीटमेंट. बिना ज़्यादा ट्रीटमेंट के. द स्कैपुला ब्रेक एट 4 साइट. स्कैपुला 4 जगहों पे टूटता है. नंबर 1 बॉडी, नंबर 2 नेक, एक्रोमियन प्रोसेस और एक होता है कोराकोइड प्रोसेस. ठीक, बॉडी, नेक, एक्रोमियन प्रोसेस और कोराकोइड प्रोसेस. द मोस्ट ऑफन फ्रैक्चर इज अनडिस्प्लेस्ड बिकॉज the fragments are held in position by the surrounding muscle. Most often, the fracture is undisplaced because the fragments are held in position by the surrounding muscle. Treatment. तो ट्रीटमेंट कैसे करेंगे? The mainstay of treatment is to restore shoulder mobility. The mainstay of treatment is to restore shoulder mobility. Restore करना shoulder mobility by active exercises as soon as pain subside. The mainstay of treatment is to restore shoulder mobility. Shoulder mobility को restore करना by active exercises as soon as pain subside. पेन खत्म हो. ट्रायंगुलर स्लिंग लगा देंगे हम लोग. ट्रायंगुलर स्लिंग फॉर पीरियड ऑफ पेन एंड स्वेलिंग. जब तक पेन और स्वेलिंग है, यूजुअली 1 वीक to 10 days, माने 7 दिन से 10 दिन तक इज यूजुअली सफिशिएंट. नेक्स्ट इज डिसलोकेशन ऑफ स्टर्नोक्लेविकुलर जॉइंट. स्टर्नोक्लेविकुलर जॉइंट जो है उसकी डिसलोकेशन के बारे में. सो दिस इज अ रेयर इंजुरी. ये बहुत रेयर होता है, हो भी नहीं करता है. जैसे हियर द मीडियल एंड ऑफ क्लेविकल इज डिस्प्लेस्ड फॉरवर्ड, आगे आ जाएगा, और रेयरली बैकवर्ड, पीछे बहुत कम जाता है. द डायग्नोसिस इज ईजियर क्लिनिकली दैन रेडियोलॉजिकली. क्लिनिकली देख के ईजी है बिकॉज इट इज़ डिफ़िकल्ट टू विजुअलाइज दिस जॉइंट ऑन एक्सरे. एक्सरे में देखने में दिक्कत ही होता है. So what is the treatment? Treatment is by reduction using direct pressure over dislocated end. The treatment है, this is by reduction using direct pressure over dislocated end. Dislocated end पे direct pressure. Reduction is maintained by figure of 8 bandage. या recurrence is common but no disability. Recurrence common है लेकिन no disability. उसके बाद में क्लेविकल की लास्ट टॉपिक है सबलक्सेशन और डिसलोकेशन ऑफ एक्रोमियोक्लेविकुलर जॉइंट. सबलक्सेशन और डिसलोकेशन ऑफ द एक्रोमियोक्लेविकुलर जॉइंट. सो दिस इज एन अनकॉमन इंजुरी. ये जो है अनकॉमन इंजुरी है, उतना ज़्यादा कॉमन नहीं है. caused by fall on the outer prominence of the shoulder. This is an uncommon injury caused by a fall on the outer prominence of shoulder. So pathoanatomy क्या है यहाँ पे? The injury may result in partial or complete rupture of acromioclavicular और coracoclavicular ligament. Once more, pathoanatomy होता है subluxation और dislocation of acromioclavicular joint की. The injury may result in partial or complete rupture of the acromioclavicular or coracoclavicular ligament. The acromioclavicular joint injury are divided into 3 grades depending upon their severity depending upon their severity. So diagnosis के लिए pain and swelling localized to the acromioclavicular joint, pain and swelling diagnosis के लिए pain and swelling localized to the acromioclavicular joint indicate an injury to this joint. So in a grade 3 injury, the lateral end of the clavicle, so in a grade 3 injury, 1, 2, 3, grade 3 injury, the lateral end of clavicle may be unusually prominent. Pain and swelling localized to the acromioclavicular joint indicates an injury to this joint. Pain and swelling localized to the acromioclavicular joint indicate an injury to this joint. Pain and swelling localized to the acromioclavicular joint. Pain and swelling localized to the acromioclavicular joint indicate an injury to this joint. Pain and swelling localized to the acromioclavicular joint indicate an injury to this joint. In a grade 3 injury, the lateral end of clavicle may be unusually prominent. In a grade 3 injury, the lateral end of the clavicle may be unusually prominent. In a grade 3 injury, lateral end of clavicle may be unusually prominent. X-ray with the acromioclavicular joint of both sides. For comparison, the same film will show the subluxation or dislocation. उसके बाद में दिया है ग्रेड ऑफ एक्रोमियोक्लेविकुलर इंजुरी. एक्रोमियोक्लेविकुलर इंजुरी के 3 ग्रेडिंग होती है, ग्रेड 1, ग्रेड 2, ग्रेड 3. पैथोएनाटॉमी ग्रेड 1 में क्या होगा, मिनिमल स्ट्रेन टू एक्रोमियोक्लेविकुलर लिगामेंट एंड जॉइंट कैप्सूल. मिनिमल स्ट्रेन टू एक्रोमियोक्लेविकुलर लिगामेंट एंड जॉइंट कैप्सूल, सिर्फ मिनिमल स्ट्रेन होगा. सेकेंड इज rupture of acromioclavicular ligament, and joint capsule भी. And third is rupture of acromioclavicular ligament, joint capsule and coracoclavicular ligament also. So treatment grade 1 and 2 injury are treated by rest in a triangular sling and analgesic. ग्रेड 1 और ग्रेड 2 को हम लोग क्या करेंगे, रेस्ट कहेंगे करने के लिए. रेस्ट इन अ ट्रायंगुलर स्लिंग बांध देंगे, रेस्ट करेगा. एंड एनाल्जेसिक जो मिनिमल स्ट्रेन और रप्चर ऑफ एक्रोमियोक्लेविकुलर जॉइंट लिगामेंट एंड जॉइंट कैप्सूल. ग्रेड 3 इंजुरी इन यंग एथलेटिक इंडिविजुअल इज ट्रीटेड बाय सर्जिकल रिपेयर. और डिसलोकेशन ऑफ शोल्डर हमने कल पढ़ लिया था. उसके बाद में ये सब हमने पढ़ा है. Then come to fracture of the surgical neck of humerus. Fracture of surgical neck of humerus. Surgical neck anatomical neck से नीचे होता है. So fracture through surgical neck of humerus occurs most often in elderly women. Elderly women में होता है. The fracture is usually caused by a fall on soldier पे गिरने से. In the majority of cases, these fracture are impacted. ज़्यादातर फ्रैक्चर में ये इम्पैक्ट ही होता है, डिस्प्लेस नहीं होता है. Sometimes they are widely displaced. कभी कभी वो ज़्यादा डिस्प्लेस होता है. The possibility of this fracture should be kept in mind in all elderly person complaining of pain in the shoulder following a fall. उम्र में ज़्यादा लोग गिरा और पेन कंप्लेन कर रहा है तो ये शंका करता है. All of the symptoms are minimal. सिम्टम जो होगा मिनिमल होगा. It is important to properly evaluate these fracture by AP and axial X-ray. AP और axial X-ray करके हमें evaluate करना होता है. तो नीर has classified these fracture into 4 types. नीर ने इसको 4 टाइप में डिवाइड किया डिपेंडिंग अपॉन द कंस्ट्रक्शन ऑफ फ्रैक्चर। तो नीर नाम का जो व्यक्ति था has classified these fracture into 4 types depending upon the construction of the fracture. He identifies 4 parts in upper end of humerus. He identified 4 parts in upper end of. So what the Neer has classified in these fracture into 4 types depending upon the construction of the fracture. He identified 4 parts in the upper end of humerus like shaft, head, greater tuberosity and lesser tuberosity. Depending upon in how many parts the bone has fractured, he divided them into 1 to 4 parts. So for example, a fracture where the head and greater tuberosity a fracture where the head, the greater tuberosity, the lesser tuberosity and the shaft. A fracture where the head, greater tuberosity, the lesser tuberosity and the shaft all have separated, it will be called a 4-part fracture. A fracture where head, greater tuberosity, lesser tuberosity and the shaft all have separated, it will be called a 4-part fracture. So this classification helps in deciding the treatment and prognosis. So in treatment, in elderly person even with moderate displacement, moderate displacement, it is generally adequate to immobilize the affected shoulder in a triangular sling. In elderly person even with moderate displacement, it is generally adequate to immobilize the affected shoulder in a triangular sling. As soon as pain subsides, shoulder mobilization is started. हम लोग क्या पढ़ रहे हैं? फ्रैक्चर नेक, सर्जिकल नेक ऑफ ह्यूमरस। तो इसमें कह रहे हैं इन एल्डरली पर्सन इवन विथ मॉडरेट डिस्प्लेसमेंट, हल्का सा डिस्प्लेसमेंट, it is generally adequate to immobilize the affected shoulder in a triangular sling में immobilize करिए. As soon as pain subsides, shoulder mobilization is started. करिए. The younger person, the fragment are widely displaced, ज़्यादा displaced होता है. They are reduced by manipulation under anesthesia. देखिए, once reduced, the fracture can be stabilized by multiple K-wire passed percutaneously under image intensifier control. Once reduced, the fracture can be stabilized by multiple K-wire. एक बार reduce हो गया, once reduced, the fracture can be stabilized by multiple K-wire. Once reduced, the fracture can be stabilized by multiple K-wire. Multiple K-wire से stabilize करेंगे. Passed percutaneously under image intensifier control. Often, open reduction and internal fixation may be required. A number of internal fixation devices have been used. From simple K-wire to modern LCP-based special plate. A number of internal fixation devices have been used from simple K-wire to modern LCP-based simple plate. A badly comminuted fracture in an elderly, replacement arthroplasty is desirable. Axillary nerve palsy and shoulder stiffness are common complications. complication. Once more हम लोग इसको पढ़ते हैं. An elderly person even with moderate displacement, it is generally adequate to immobilize the affected shoulder in a triangular sling. As soon as pain subsides, shoulder mobilization is started. In a younger person, the fragments are widely displaced. They are reduced by manipulation under general anesthesia. Once reduced, the fracture can be stabilized by multiple K-wire passed percutaneously under image intensifier control. Often open reduction and internal fixation may be required. A number of internal fixation devices have been used, from simple K-wire to modern LCP-based special plate. In badly comminuted fracture in an elderly, replacement arthroplasty is desirable. Axillary nerve palsy and shoulder stiffness are common complications. So look at the Philos plate, osteosuture, percutaneous K-wire, and LPHP, the method of fixation of surgical neck of humerus. Next, we will have fracture of greater tuberosity of humerus. Fracture of greater tuberosity of humerus. How? Fracture of the greater tuberosity of humerus. Fracture of the greater tuberosity of the humerus occurs in adult. Fracture of the greater tuberosity of humerus. Fracture of greater tuberosity of humerus occurs in adult में होता है, जवान लोग. The fracture is usually caused by a fall on shoulder, and is displaced and comminuted, Sometimes it is widely separated due to pull by the muscle. Sometimes it is widely separated due to pull by muscle supraspinatus attached to it. एक बार फिर से रिवाइज करते हैं. So fracture of greater tuberosity of humerus. The fracture of greater tuberosity of the humerus occurs in adult. Fracture is usually caused by fall on the shoulder. Fall होगा तो, and it is undisplaced and comminuted. Undisplaced होता है, comminuted भी हो सकता है. Sometimes it is widely separated due to pull by muscle के pull से supraspinatus attached to it. So treatment क्या करेंगे? Treatment में for minimally displaced या comminuted fracture, rest in triangular sling is enough. Triangular sling में रखेंगे तब ठीक है. The shoulder is mobilized as soon as pain subsides. जब पेन खत्म होगा, then shoulder should be immobilized. For displaced fracture, displaced है, reduction is achieved by either holding the shoulder abducted in a plaster cast में shoulder abduct करके रखें, और by open reduction and internal fixation. So painful arc syndrome and shoulder stiffness. Painful arc syndrome and shoulder stiffness are the usual complications. Okay. इसके बाद में हम लोग पढ़ेंगे फ्रैक्चर ऑफ द शाफ्ट ऑफ ह्यूमरस. फ्रैक्चर ऑफ द शाफ्ट ऑफ ह्यूमरस, इसमें क्या होता है? So this is a common fracture in patient at any age. This is a common fracture in a patient at any age. It is usually sustained from an indirect twisting. From an indirect twisting. So fracture of the shaft of humerus. Fracture of the shaft of humerus. So this is a common fracture in patient at any age. Fracture of the shaft of humerus. So this is a common fracture in patient at any age. It is usually sustained from an indirect twisting or bending force, as may be sustained in a fall or outstretched hand, or by a direct injury to the arm. So this is a common fracture in patient at any age, कोई भी age में. It is usually sustained from an indirect twisting. होता है कैसे? indirect twisting और bending force के वजह से, as may be sustained in a fall on outstretched hand, or by a direct injury to arm, So relevant anatomy क्या हो सकता है? The humerus is a typical long bone. Upper half of shaft is roughly cylindrical. होता है and begin to flatten in its lower half. चौपटा होना. Begin to flatten in its lower half in the anteroposterior direction. The deltoid muscle is inserted on the deltoid tuberosity on the anterolateral surface of the bone, just proximal to its middle third. The posterior surface is crossed obliquely by a shallow groove for the radial nerve. The humerus is surrounded by muscles. So this has the following clinical relevance. Number 1, incidence of compound fracture is low. Compound fracture होने की incidence कम है. The union of fracture occurs early because bone so well surrounded by muscle has a rich periosteal blood supply. And third one is some degree of malunion is masked by thick muscle cover. So pathoanatomy क्या होगा यहाँ पे? A humerus fracture can be considered a prototype. Fracture because it occurs in all pattern. Humerus fracture can be considered a prototype because it occurs in all pattern: transverse, oblique, spiral, comminuted, segmental. May be closed or open, may be traumatic or pathological. So displacement are variable. It may be an undisplaced fracture, or there may be marked angulation or overlapping of fragments. Displacement are variable. It may be undisplaced. Displacement are variable. It may be an undisplaced fracture. Displacement are variable. It may be an undisplaced fracture, or there may be marked angulation or overlapping of fragment. So lateral angulation is common because of the abduction of the proximal fragment by deltoid muscle. Lateral angulation is common because of the abduction of proximal fragment by deltoid muscle. So this angulation is further increased by the tendency of the patient to keep the limb by side of his chest, resulting in adduction of the distal fragment. Often distraction occur at the fracture site because of the gravity. तो समझ में नहीं आया क्या कहते हैं. पैथोएनाटोमी फिर से पढ़ते हैं. The humerus can be considered a prototype fracture because it occurs in all pattern: transverse, oblique, spiral, comminuted, segmental. May be closed or open, may be traumatic or pathological. So displacement are variable. It may be an undisplaced fracture, or there may be marked angulation or overlapping of fragment. Lateral angulation is common because of the abduction of the proximal fragment by deltoid muscle. So this angulation is further increased by the tendency of patient to keep the limb at the side of his chest, resulting in adduction of the distal fragment. Often distraction occur at the fracture site because of the gravity. A diagnosis is simple because the patient presents with classic sign and symptom of a fracture. Diagnosis is simple because the patient presents with the classic sign and symptom of a fracture. There may be wrist drop if the radial nerve is injured. X-ray of whole arm including the shoulder and elbow should be done. तो ट्रीटमेंट क्या करेंगे? ट्रीटमेंट में most of these fracture unite easily. Anatomical reduction is not necessary as long as fracture is stable. Some amount of displacement and angulation is acceptable. So most of these fracture unite easily. Anatomical reduction is not necessary as long as fracture is stable. Some amount of displacement and angulation is acceptable. So this is due to following reason. Number 1, limitation of motion. Because of a moderate malunion, थोड़ा सा malunion in angulation or rotation go unnoticed because of multi-axial shoulder joint proximally. Multi-axial shoulder joint proximally. Some amount of shortening goes undetected in upper limb, unlike in the lower limb where shortening produces a limp. And third is bone is covered with thick muscle so that a malunited fracture is not noticeable, unlike the tibia where malunion is easily noticeable. Strict mobilization is not necessary. Strict mobilization is not necessary. The aim of treatment, strict immobilization is not necessary. The aim of treatment is pain relief and prevention of lateral angulation. Strict immobilization is not necessary. The aim of treatment is pain relief and prevention of lateral angulation and distraction. So it is possible to achieve this by conservative means in most cases. So conservative method, the following conservative method are useful in most cases. Number 1, use slab. So this is a plaster slab extending from base of neck over the shoulder onto the lateral aspect of the arm, under the elbow to the medial side of arm. It should be molded on the lateral side of the arm in order to prevent lateral angulation. The U slab is supported with triangular sling. Once the fracture unite, the slab is removed approximately 6 to 8 weeks and shoulder exercise is started. दूसरा होता है हैंगिंग कास्ट. सो हैंगिंग कास्ट, इसमें देखो यू स्लैब ऐसा होता है. And hanging in cast, it is used in some cases of lower third fracture of the humerus. The weight of limb and the cast is supposed to provide necessary traction to keep the fracture aligned. Chest arm bandage. The arm is strapped to the chest. This much mobilization is sufficient for fracture of the humerus in children less than 5 years of age. In adults, early mobilization of the limb can be begun by using cast brace once the fracture becomes sticky. So operative method, in cases where a reduction is not possible by close manipulation or if the fracture is very unstable, open reduction and internal fixation is required. So most fracture can be fixed well with plate and screw. Intramedullary nailing is another method of internal fixation. Contaminated open or infected fracture are stabilized by using an external fixator. उसके बाद आते हैं complication. The complication में होता है nerve injury. The radial nerve is commonly injured in a fracture of humeral shaft. The injury to the nerve is generally a neuropraxia only. It may be sustained at the time of fracture, during manipulation of the fracture, or while the fracture is healing. nerve entrapment in the callus. A special type of humerus fracture where there is a spiral fracture at the junction of the middle and distal third is commonly known to be associated with radial nerve palsy. A special type of humerus fracture where there is a spiral fracture at the junction of middle and distal third is commonly associated with radial nerve palsy. This is called Holstein-Lewis fracture. The radial nerve injury results in paralysis of wrist, finger, thumb extensor. The radial nerve injury results in paralysis of wrist, finger, and thumb extensor, a wrist drop, brachioradialis, and the supinator. So there is a sensory change in a small area of radial side of back of hand. The treatment for cases reporting early, treatment depends on expected type of nerve injury. In most closed fracture, the nerve recovery spontaneously. In open fracture, exploration is usually required. In neglected cases, when repair of a divided nerve is impractical, tendon transfer are needed. So treatment for cases reporting early, treatment depends on expected time of nerve injury. In most closed fracture, the nerve recovery spontaneously. In open fracture, exploration is usually required. In neglected cases or when repair of divided nerve is impractical, tendon transfer are needed. Modified zone transfer is most popular. Modified zones transfer. Zone bhaiga. Here the muscles of forearm supplied by median and ulnar nerve are used for substituting wrist extensor. Wrist extensor पहले जाके रखेंगे इसको. Finger extension and thumb abduction extension. The following tendon are used. So pronator teres जो होता है वो किसके लिए यूज करेंगे? Extensor carpi radialis brevis. Pronator teres for extensor carpi radialis brevis. Flexor carpi ulnaris for extensor digitorum. Extensor digitorum के लिए. Palmaris longus for extensor pollicis longus. And last is delayed and non-union. Fracture of shaft of humerus, especially transverse fracture of the mid shaft, often go into delayed or non-union. Delay union या non-union में जाएगा. The causes of non-union are inadequate mobilization. Cause क्या होगा? Causes of non-union, inadequate mobilization, सही से mobilization नहीं हुआ, और distraction at the fracture site because of the gravity. Treatment: open reduction, internal fixation. Treatment: open reduction, internal fixation with a plate and bone grafting is usually performed. In cases where quality of bone is poor, an intramedullary fibular graft may be used to enhance the fixation. Open reduction, internal fixation with a plate and bone grafting is usually performed in cases where quality of bone is poor, and intramedullary fibular graft may be used to enhance the fixation. The limb is suitably immobilized using a U-slab or shoulder spica.